Bismillahirrahmanirrahim. Quote of the day: start each day with a positive thought. Today, I will present the critical appraisal under kind supervision of Professor Dr. Saira Afzal. And the topic of my presentation is a narrative review: impact of climate change on the epidemiology of vector-borne disease in Pakistan. And the checklist that we use for this narrative review is AND-JR checklist. These are the points that are critically appraised in this article. This is the screenshot of abstract in which they define about the climate change is hardly reality that has already started affecting air quality, food production, water supply, coastal settlement, and human health. Early warning systems for preventing outbreaks are direly needed. No study has been done on the effect of climate change on vector-borne disease in Pakistan. Long-term observational studies and a multidisciplinary effort are needed to monitor climate change effect on vector-borne disease in Pakistan. It is essential to establish a vector surveillance system, integrated vector management, and climate change with the utmost priority for the prevention and control of vector-borne diseases in Pakistan. So, according to the checklist, in the title of the article, study design did not mention. There is an unstructured abstract, but abstract provide a balanced and informative summary of what was done and what was found. Objective of study clearly mentioned in the abstract. Now comes the introduction section. And in the introduction section of the article, the background was clearly mentioned. World statistic also mentioned in the introduction section. In third paragraph, they mentioned geographic location of Pakistan and clearly mentioned the different temperature zone of the country. Rationale of the study was not given in the introduction, but the objective and rationale was clearly mentioned in the abstract, but it was not given in the introduction section. Article. This is the methodology of the article which are used. We search all Web of Sciences database for reviewed article published between 1960 to December 2019. Such terms were related to vector-borne diseases, dengue, malaria, chikungunya, serum in Congo hemorrhagic fever, leishmaniasis, West Nile virus, Japanese encephalitis, and yellow fever. Present or historical occurrence in province like Balochistan, Punjab, Sindh, Khyber Pakhtunkhwa, Azad Jammu Kashmir, and Gilgit-Baltistan, and the climate change assessment. Only reviewed articles published in English were included, and year-wise geographical distribution of vector-borne disease outbreak in Pakistan were summarized. We did not find any published article related to the occurrence of yellow fever, so it is excluded from the study. So this is the search methodology that are used for identifying the article, but there is no prisma flow diagram given in this article. The main vector-borne diseases highlighted in this article are malaria, dengue, chikungunya, leishmaniasis, West Nile fever, and serum in Congo hemorrhagic fever. They discuss two types of climate change and its effect on the vector-borne disease in this article. Transmission temperature lie in the range of 14 to 18 degrees centigrade at the lower end and 35 to 40 degrees centigrade at the upper end. At higher temperature, 30 to 32 degrees centigrade, there is reduction in the extrinsic incubation period of the pathogen. So the suitable temperature for the disease is 14 to 18 degrees centigrade and 35 to 40. and the effect of precipitation on vector and pathogen. For vector-borne disease, higher precipitation has been associated with dengue fever, malaria, scrub typhus, and Japanese encephalitis. The survival may increase as increased the rain, may increase breeding places by increasing water storage and growth environment for vector and host. So according to a checklist, they specify the process for identifying the literature search, for example, year considered, language, publication status, and database of the coverage. And in a methodology section of this article, they also give the epidemiology of all these diseases in the form of map. So this is the map showing the epidemiology of the dengue in Pakistan currently and diachronically. So you can clearly see the red area where the most of the dengue cases are reported, and the main area is KPK and the Punjab province, and also some cases are found in the Sindh province. The Balochistan region is also affected, but there are only a few number of cases in this region. So the main area that are affected from dengue is KPK and Punjab. Now this is also a map showing the epidemiology of Syrian Congo hemorrhagic fever in Pakistan currently and diachronically. This is the data of different years which are presented, and in this disease you can see clearly the Balochistan province of the Pakistan is affected mostly from this disease, and then the KPK and Punjab. Little bit cases is identified in the Karachi region. This is also one of the map which showing the epidemiology of cutaneous leishmaniasis in Pakistan currently and diachronically, and the most of the area which are affected is almost Balochistan, Sindh, Punjab, and KPK. So this disease is endemic in all areas of Pakistan. In the methodology section, they provide the result in the form of year-wise geographical distribution of vector-borne disease, malaria, dengue, chikungunya, Syrian Congo hemorrhagic fever, and cutaneous leishmaniasis. In the form of table, all these diseases are covered. In these tables, they identify the reported cases in different years and locate the area of identified case. But the data on mortality rate from these cases and treated cases from these diseases cannot present in the tabulated form. So they will only report the geographical location, their year, and the number of reported cases in that specific year. And then there is a discussion section of this article in which they summarize the key result with the reference of other study. They did not address any bias in discussion section, and they address the need for future research is pretty much clear, and discuss the generalizability of result in the discussion section. And in the summary, they summarize the results, and then they give the future location. A multidisciplinary effort is needed to handle the situation before the vector-borne disease become an epidemic in non-endemic area. So in conclusion, they provide an overall interpretation of the narrative review in the context of clinical practice, policy development, and implementation, and it is useful for future research. This is a SANRA checklist, which is a quality assessment tool for the narrative review article, and there are 6 points that are numbered according to their uh, quality. And the first point is justification of the article importance for the readership. The importance is not justified. The importance is attitude but not explicitly justified. The importance is explicitly justified. And the number which I gave to this point is 2 number, because the importance of this article is explicitly justified. Statement of concrete aims or formulation of question. No aims or question are founded. Aims are formulated generally but not concretely or in terms of clear question. One or more concrete aims or question are formulated. So I will give the 1 number, because aims are formulated generally but not in terms of clear question. And the description of literature search, the search strategy is not presented. The literature search is described briefly. The literature search is described in detail, including search term and inclusion criteria. So I will give the 1 point, because the literature search is described briefly, but not in the terms of search term and inclusion criteria or exclusion criteria. And there are also no flow diagram is present in this article. And in the referencing, key statement are not supported by references. The referencing of key statement is inconsistent. Key elements are supported by references. So the number which I gave is 2, because key statement are supported by references. Scientific reasoning, the article's point is not based on appropriate argument. Appropriate evidence is introduced selectively. Appropriate evidence is generally present. The number which I gave is 1, because appropriate evidence is introduced selectively. And the appropriate presentation of data. Data are presented inadequately. Data are often not present in the most appropriate way. Relevant outcome data are generally present appropriately. So the number is 1, because the data are often not present in most appropriate way. I can already explain that they will not give the data of mortality rate or the treated cases. They only give the year-wise distribution, case reported, and the location of cities. So the overall number of this study is 8 from 12, because these are 6 points. This is the YouTube link of this journal, this critical appraisal, and thank you.
Thank you very much. Very nice presentation, Dr. Naila. I am so impressed by the graphics that you have presented, and making the things very clear about the distribution of the infectious diseases in various parts of Pakistan, especially of Crimean Congo, hemorrhagic fever, and other diseases. I would like Dr. Amber and Dr. Khansa to please comment on these slides as well as research. Dr. Amber, would you please go ahead?
जी, अस्सलाम वालेकुम मैम, अस्सलाम वालेकुम Dr. Naila and everyone. It was a very nice presentation overall regarding the slides, how crowded they were, and they were very neatly presented with all the important graphs and tables, graphics, and the figures that were needed to be included. However, there are some points I would like to add, and I would start in a systematic manner. So, starting from a title, it clearly shows how they are focusing on the impact. So, an impact is what is intended, what is the intended outcome, who experiences it, contribution of the variable to that outcome, and the risk that an impact doesn't happen as planned. And whenever we are talking about an impact, so there are different types of impact, like cultural, social, economic impact, environmental impact, health, or political impact. So in my opinion, when regarding to the title, it's not very clear in terms of which type of impact they wanted to measure, either only they are focusing on the health impact, the cultural, political, and so it was not very specific here. When coming to the abstract, again, there is no mention of the type of impact. No studies published is frequently used all over the narrative review. And since the clear objective statement was missing, so it was difficult to understand what the purpose of the study was actually intended to, which outcomes. And the implications in policy development, however, was mentioned. In introduction, the rationale of the study, however, the purpose they try to start emphasize on the vector-borne diseases regarding their geographic distribution and high number of incident cases and prevalent cases. However, the rationale for conducting this narrative review was quite weak. The methods, the information regarding databases, timelines, and the relative the retrieved articles was somehow given, but number of articles and in inclusion and exclusion criteria was missing from that. And then when they were giving the results, I will second Dr. Naila's observation that they tabulated and they gave it in figures form, but in the narrative part could have been improved for other variables like cultural, social, economic impacts as well. Would have added it other than only the incident cases and along with the mortality and the treated cases. Then the key fundamental findings, and that is the climate change, would have strengthened the whole narrative. Limitations always as are also not mentioned, and there is a lack of operationalization of the terms, and way forward is also missing. So by only reporting the cases and the geographic areas following how they justified the climate changes impacts and difference in rainfall and vector transmission and temperature changes, so not enough studies were also mentioned in discussion to justify their observations gave in the narrative. So the study was lacking in clarity, clear purpose of plot, and lack of dynamic word choice for satisfying the conclusion. So this is all from my side. If anybody else wants to add, it's open for discussion.
Assalamualaikum.
Thank you very much.
Dr. Amber
Dr.
has
Khamsa?
explained. Assalamualaikum. Dr. Amber has already explained very well. I have only 2 to 3 points to discuss. First of all, they are targeting the epidemiology of vector-borne disease. First of all, epidemiology is such a vast subject. They must be narrow the focus. What the type of epidemiology, descriptive, analytical, time, person, place, distribution, they don't mention. And if we see the impact, Dr. Amber already has described that they don't mention any type of impact. I have 1 to 2 to 3 point that they should study the climate change impact assessment, and they should identify and quantify their impact assessment in the form of expected impact of climate change. Second type of climate impact assessment, which is most commonly, is vulnerability assessment, which is actually to determine a system sensitivity and ability to adapt to climate change of vector-borne disease. Third assessment, natural resource assessment, which is generally describe the current condition of specific natural resources as the factors that are affecting, with the goal of providing timely and relevant accessible information for decision making. Therefore, the three main type of climate assessment, climate change impact, vulnerability assessment, and natural resource assessment. And therefore, the vulnerability also, which is a function of exposure, sensitivity, and adaptive capacity, is not mentioned. Exposure is made up of primary factor, for example, temperature, precipitation, secondary factors, sun level rise, vegetation, non-climate stressors, and adaptive capacity of any area, and specialized habits of organism and environmental stressors. They should be mentioned. And if we see in the methodology, there is no clear specific hypothesis or question, no technique or any guidelines follow, and discussion is also very not scientifically background is good, and there is no such strength and weaknesses of article, and there is no policy formulation or implication. This is some points from me.
Thank you very much, Dr. Khansa. Very elaborative and very good discussion on this article. Thank you very much, everyone, for joining us. And see you, inshallah, soon. Allah Hafiz.
Good Hafiz, ma'am.
Allah Hafiz.